Hello and welcome to part 4 of Ticking to Myself, my heart surgery video diary. Yesterday I had another new experience, which was I had to attend my cardiac rehabilitation meeting with the nurse specialist service. My cardiac nurse is Tracy Lowe. And I've not had, again, this is an experience that I've not had before, because last time, as I've mentioned previously, I was already in hospital when I had went down for surgery, so I didn't experience the normal routine that you would expect before you go in for cardiac surgery. So again, this was a new experience. I wasn't too sure about how useful it was going to be. But as it turned out, I found it really interesting, because I think I was in with the nurse for about 2 hours, and she was extremely thorough, and because of my history, she took a lot of time to make sure things were correct, that all my details were correct, that she had all the full amount of information as to what I'd been through before, so she was fully aware of what had happened to me in the past, so that she could build up a plan of action for the future, for when I'm discharged and the following sort of 4 to 5 weeks afterwards. I've got to admit, I was a little bit sceptical when I walked in there, but I came out feeling extremely pleased with how it had gone. As I said, she was thorough. She went through every aspect of it leading up to surgery. She went through the whole process while I'm in hospital, some of which I knew, some of which I didn't, and how I would be cared for when I was discharged, and that my care would fall to her and her team immediately after I'm discharged from Leeds General Infirmary after my open heart surgery. What I did find interesting was that I didn't realise that they had such a close link with the hospital that I'm going to, because we're in a different area. I live in Wakefield in West Yorkshire. I'm having my surgery at Leeds. But as it turns out, she knows my surgeon really well. She knows my cardiologist really well. And she's fully aware of the procedure all the way through. So that was quite nice to know that she was aware of all the people that I'm aware of, which is reassuring in some respects. We had a discussion about how I was feeling, and I went through all the feelings that I was experiencing, including the ones that do weigh on your mind, that prey on your mind, about you not making it through surgery, about it being the last time you'll see everybody when you go in. But I have to say, for the first time, she is the first person that I've spoken to in the medical circle that I've spoken to so far that has really put my mind at rest. What she said was, if I can get through what I got through last time unscathed and come through it, then there's absolutely no reason why I shouldn't come through it on this occasion. I don't have any coronary artery problems. I don't have any diabetes problems. I don't have any breathing problems. My ECG shows a good, strong, steady heart rhythm. It's a normal sinus rhythm. We went through that. So the letters that she's got from my surgeon and from my cardiologist don't indicate to her that there is anything for me to worry about. There's nothing there that is a great concern. The only concern that she does have and which I think is justified, is that it's a second operation, and as she explained, things are a bit tougher getting in there to get to my heart, and that is because of previous scar tissue from the first operation. So things aren't quite as easy to get in because there's other things that are a lot thicker, a lot more harder. My sternum will have created calcified parts to it around the metal pins, the metal wires that hold my sternum together. And then of course there's the actual removal of the previous valve, which is stitched in with lots and lots and lots of stitches. So that has to come out as well. So her feelings were that the main problem might occur from the speed that I might heal at, and that would be it. Again, I don't have any blood pressure problems, anything like that. So that's reassuring, and it actually lightened my mood quite a lot, because nobody's actually sat me down and said, actually Steve, you've got nothing to worry about because you've been through a hell of a lot before. No, much worse situation last time, health-wise. Now you are relatively fit and healthy, with no, other problems stuck on top. So that was nice to hear. And I said I did walk out with quite a happy demeanour as I left the clinic. On the preparation front, I'm still using the nose cream, the Herceptin, to keep away the MRSA bugs. Tonight is my last dose of warfarin that I shall be taking before my surgery. Tomorrow I start using the antibacterial scrub, body wash type thing. And tomorrow is the last day that I will take my Ramipril tablets. So tomorrow that'll be it. I'll be as ready as I'm going to be, with the exception of a few more days of the body scrub. So all in all, I'm getting towards it quite okay. Things are going well. My mood's lightened a bit from what it was a few days ago. Still not looking forward to it. I don't think it is something you can look forward to. I think the only thing that I can say is that I'm looking forward to it being done, finished, and starting the recovery process. I was talking to Sam the other night, and yeah, I think the thing is now to look at the other side and look forward to the recovery part of it, because there are good things ahead in the future, and I want to get stuck into my recovery and planning the rest of my life after this operation. It's been a long time coming, and I just want it doing now and getting it over and done with, and getting back to some pizza afterwards. So with that, that's pretty much it for now. I think I'll be doing one more update before I go in for surgery, and that one will be from hospital when I'm admitted on Tuesday. So I hope you've enjoyed the update so far. If you've got any questions, by all means give me a shout. I'll answer them if I can. But I'll say bye for now.